Would you rather have tape up to your knee on the front or the back?
Can we lay down?
Some of the tapings go all the way to your knee. Would you rather have those on the front or on the back?
Doesn't matter.
Okay, just checking. First of our tapings today is the high dye. High dye is better at subtalar joint control than a low dye. Okay. Created by the same guy, Dr. Dye. Start with an anchor strip, usually just below the fibular head. That's, on most people, roughly tibial tuberosity level. That's a 2-inch anchor strap. Make sure the foot's perpendicular to the leg, and of course you would have cleaned the limb off and all that fun stuff first. The original description does all the medial ankle strip parts first and then the laterals. I vary it depending on the condition. You're going to start near the calcaneal cuboid joint, get it set across the bottom. You're coming up across the inside of the ankle to the lateral side of the leg. You're going to do 3 of those. You overlap half your tape width. Once posterior, once anterior. This is one of the few tapings I've seen that can work without putting a second layer of them on. If you had a really heavy patient, I'd still put 2 layers on. Then you do the lateral strips. They start near the navicular tuberosity level. Come across the plantar foot, up along the lateral side of the leg, lateral ankle, then medial leg. That's better. Second one of those, I usually do that one more posterior. Gives you better rear foot control. Then you cover your anchor strip. Then you put on a low dye. That's part of the high dye. The variety of low dye you put on will be the one that you like to use best. Today I'll put on fairly standard low dye. When you already have an ankle taping on both sides your low dye doesn't like to stick well. Still got to fold. This is definitely cheaper tape. Works really well for PT tendinitis. If you're a heavier person with a rigid flat foot that is painful, frequently you don't get them controlled with a low dye. It doesn't help. If you do the strips the other way and do 3 laterals and 2 medials, it would work pretty well for perineal tendinitis. So there's a high dye.